This video is presented by College of Otorhinolaryngologists and Head and Neck Surgeons of Sri Lanka to be used by medical students and medical professionals. This video is a demonstration of steps of ear examination.
Good morning. Take a seat.
Introduce yourself to the patient including your name and role, and explain the procedure to the patient, and then proceed to obtain consent from the patient for the examination. Also ensure there is good lighting in the room, which would facilitate the examination.
I am Sumudu Walisinghe. Now I am going to examine your ear. During this procedure, if you feel any discomfort, please let me know.
Wash your hands with soap and water, following the steps to the recommended hand washing technique for healthcare workers. The next step is to wear disposable gloves. To begin with the inspection of the ear, it is best to start with the better hearing ear first after inquiring for any pain and tenderness. Inspect the ear with adequate light. The light source of the otoscope or the headlight may be used. Look at the color of the ear and around the ear. Look at the shape of the pinna. Look for congenital defects and abnormalities of the ear. Look in the pre-auricular region for surgical scars. Look at the post-auricular region for surgical scars and proceed with the mastoid region inspection for visible anomalies and palpation for tenderness. For the next part of the ear examination, palpate the pinna and tragus for tenderness.
When I am palpating, tell me whether you feel any pain.
Yeah, okay.
In the next part of the ear examination, an otoscope will be used. There are various sizes of ear speculums used to adjust the light source in an otoscope. Make sure to choose the correct size according to the age of the patient, and always choose the largest speculum to see the external ear and tympanic membrane more clearly. Make sure to properly connect the speculum onto the otoscope. Turn on the light source of the otoscope and check it by examining it on your palm. The otoscope should be held like holding a pen between the thumb and the index finger. If the right ear of the patient is being examined, hold it using your right hand, and vice versa if the left ear of the patient is being examined. Extend the little finger while holding the otoscope so that it will rest against the patient's cheek. Hence, the device will move with the patient, which will prevent stabbing the ear during sudden movements, which is specifically important while examining a child. In a normal tympanic membrane, you will be able to see the handle of the malleus. The light reflects on the anteroinferior quadrant, the pars tensa, and superiorly the pars facida. If the right ear of the patient is being examined, hold the pinna with your left hand and vice versa for the left ear. In adults, hold the pinna upwards, outwards, and backwards, and in children, hold it down and back. Now gently and carefully introduce the otoscope into the patient's ear. Look around the external ear canal for wax and abnormalities such as discharge, inflammation, and obstruction. Proceed with the same precautions down the external ear canal to observe the tympanic membrane, and in order to optimize visualization of the membrane, move the speculum around. Once thorough examination of one ear is completed, continue with the examination of the other ear. While withdrawing the otoscope from the ear, carefully look around for abnormalities in the external ear canal that could have been missed while inserting it in. To conclude the examination, do a facial nerve examination along with some hearing tests using tuning forks and an audiometer. And make sure to thank the patient. Thank you.